I got on my exercise bike and I started pumping along, and I rode for about 10 minutes, and I started feeling a tightness in my chest, kind of on both sides of my sternum, and finally I got to about the halfway mark, about 3 miles, and I never quit before 5, because why even bother to get on the bike if you're not going to do the full 5? And I've never quit before 5, and I got to 3 and I said, I gotta quit.
And he came in, and he's done it before where he has, he's dehydrated and he's dizzy and that type of thing. And he sat down, and I thought, okay, what's going on? And then he laid on the floor, or dropped to the floor, and I went over and I was like, what's wrong with you? And he's like, he really couldn't even talk. And so finally, his story's a little different than mine, but finally he just kind of took his fist and pounced on his chest. And I went, okay, you're having a heart attack.
I get this page that we have this patient in the ER, coming to the ER, not arrived yet, with a possible STEMI, which is something we all get very concerned about. So we went to the emergency room waiting for him to come in, and we saw him being rolled in by the EMS, and he had that hand on his chest, the classic sign where people are trying to suggest they're having crushing pain in their chest and a sign of a heart attack. And we were just in process of bringing him over to the cath lab, and he just lost his pulse, and we had to first now stabilize him and resuscitate him. So we started that process while he was on that bed. So we did shock him a few times. We started resuscitating him per our ACLS protocol, all of those things, chest compressions, medications to stop this rhythm.
I found out later on what had happened when they told me that I had 53
Shots.
zaps, and that was just a number that I couldn't wrap my head around, because I never imagined that anybody could possibly be zapped that many times. And
still be here.
it was like no quit Tuesday or something. It was like, let's save this guy no matter what.
So I did ask for my colleagues to come and help if they are available, and I asked for Dr. Olson, who is one of our senior interventional cardiologists, and Dr. Merritt, who is our wonderful cardiac surgeon. So both of them came in.
The patient was very critically ill, and she was having problems making progress in the case just because the patient was so ill, and probably needed another set of hands to help her handle the situation.
At the time I walked in, they had regained hemodynamics, meaning that the patient had his own rhythm at that point. And so they were working really diligently to try to open up the vessel. I saw Dr. Madon and Dr. Olson working together in that moment, and the focus of everyone in the room on the patient's vitals and trying to get that vessel open.
He was fortunate. We were able to open that artery very quickly. We placed a stent, and the artery seemed really good, open, and the flow was good. He stabilized for a little while as the artery opened up and the blood flow started to restore, but his blood pressures were still quite marginal.
So we paused and we had a discussion about when was going to be the right time to initiate circulatory support with ECMO. And that was a helpful conversation for us to start getting everything that we needed organized. ECMO is reserved for the sickest of sick patients. So when somebody were unable to get a rhythm back, or they continue to have issues with their hemodynamics, or their pump, their heart function itself is not good enough to support what they need to maintain life, that's when we consider that. And it has to be a specific group of patients. So it has to be patients who, like our patient here, were otherwise healthy, and those patients have the best outcome with ECMO.
And after that, the EKG changes that suggested the heart attack, they subsided quickly as the artery opened. I was very hopeful that we had accomplished giving him the best result that we could.
She was wonderful. I felt like when she came out that before we did hug each other, I felt like I had just been engulfed with a huge hug from this whole hospital. And it was a good feeling. It was a good feeling.
What Dr. Madon and the team, what they did for me I have to do everything I can to make sure I facilitate their effort. I mean, to me, that was superhuman.
Every single person plays their part. It's amazing to look from a bird's eye view as we're getting everything going for a big operation like this, where there's multiple teams involved. There's anesthesia dealing with the airway and the hemodynamics. There's the interventional cardiologists who are working diligently to try to reverse the problem that set all of this off. And then there's the cardiothoracic surgery team. And when all of it works perfectly, it's like a beautiful orchestra coming together with a beautiful piece at the end of it.
They all were part of a team that saved my life. How can I ever thank them for that? How do you thank someone for saving your life? There just are no words.
And he said, which I will never forget, that thank you for bringing me back to my family. And so I thought that was something that I will truly cherish forever.